the neat thing about cardiac surgery is that we operate on people for things that can be prevented. So it's not like we're neurosurgeons. You can't prevent a brain tumor, but you can do a lot of things to prevent coronary disease. But somehow the message isn't getting out there.
Mm-hmm. I agree with you. I think over the past, we've both been involved with medicine and cardiac surgery for over 25 years. And I think what we've always talked about and both have learned is that during that time, the information that we understand, all people can understand. And when people come in and see us, we tell them, high blood pressure is a risk. High cholesterol is a risk. Smoking is a risk. Not exercising is a risk. Diabetes is a risk. And even though they know this, and even though we try to impart this, there's nothing that is really done. And when I say they know this, what we're finding is actually they really don't. They don't understand it. And I think with constant affirmation, in some way discussions where people can see and understand and learn, that then they start to understand, oh, these are the things that I need to work on. And these are the simple things, like you said, that we can impart in some way just through discussion.
I think that one of the things that we both enjoy is our relationship with our patients. And many times we hear patients say, wow, it was never explained to me quite that way, or doctors tend to use big words, but you seem to use smaller words. And well, the reason why I do is because my dad told me, boy, I don't care how much education you get, don't you ever forget how to talk to people. My father only had a 6th grade education, and it's always ingrained that in me. But I think one of the things we enjoy in our practice is that we can approach people on whatever level they are, whether they are internet savvy and have some sophistication about medical terminology, or whether they don't even know what the word hypertension means.
Right, right. I certainly agree with you. One of the main issues I even left out was one of family history. So that if you know one of your parent, your brother, your sister had a certain illness at a certain age, that means that as you approach that age, you should probably be looking at how can I prevent it, or am I at risk? And as you know, the majority of people that we see, they don't do that. They usually wait after the fact, and then unfortunately some damage is usually done.
It's amazing to me, people we operate on in their 50s, your age, that know that their dad and their uncle and their brother had an MI in their 50s, and yet when you look at their lifestyle, they're smoking, they are not exercising, they're not eating a proper diet. All these things. Why hasn't that message gotten through to them?
Right, right. And in this day and age, what we're seeing more of, which is also quite interesting, is that of fast food, that of increased smoking, that of increased stress. And how do you in some way start to engage in conversation in order to educate? As you know, for both of us, we've been doing this many years and we enjoy it. But now we want to take it a step further and see how can we engage with people on this conversation and truly make it a conversation where we get a response back and ask us what is going on, why, what can we do? Because that's what we're here for. We're here to answer it and go beyond just operating.
So I'm really looking forward to doing this plot.
I am too.
I hope it will really help people and be able to share whatever we have to offer.
That's right. And we look forward to talking to you.